Open enrollment is here, and this is your once-a-year opportunity to make sure your health insurance plan matches your and your family's needs. Unless you have a major life event that qualifies you to make changes, such as a marriage or birth or adoption, your selection during open enrollment is your only chance to change your health plan until next year. Before you choose a plan, it's a good idea to review your current situation. Did you encounter any situations last year that might have been better suited for a different plan? Do you anticipate any changes to your or your family's health? Once you have considered those questions, you can review our available options. First, we can easily eliminate some options. 2 of our health plans are limited by where you live. If you live in central Kentucky, which includes Fayette and surrounding counties, you may enroll in the UK HMO, our most popular plan. Anyone on the UK HMO may only receive care from UK Healthcare. If you live outside central Kentucky, you are eligible for the UK RHP, or Regional Health Plan. This plan provides the same benefits as the HMO, but it allows you to see providers outside of UK Healthcare, since those providers and facilities are less convenient. Next, let's compare the UK HMO, PPO, and EPO plans and point out some key differences. You'll notice right away that the monthly premium, or the portion you pay for healthcare, is the same for the HMO and PPO plans. The monthly cost for the EPO plan is substantially higher. Annually, an employee covering only themselves would pay almost $1,900 more for the EPO plan. For family coverage, the difference is more than $4,700. We'll look at some of the reasons this might make sense a little later. As I mentioned earlier, on the UK HMO, you will use only UK healthcare providers, and you have the option of visiting a Concentra Urgent Treatment Center for urgent care. With the PPO and EPO plans, you have the option to see UK healthcare providers in addition to any provider who is part of the Anthem network. The overall amount you pay for healthcare is a combination of factors. First, there are the monthly premiums, which are automatically deducted from your pay. Second, there are deductibles. This is the amount you must pay before your insurance will begin payment for some services. Not all plans come with a deductible. Third, there are copays and coinsurance. A copay is a set amount you pay for a healthcare service. For example, employees on the UK HMO pay $10 for a visit to a primary care doctor. Finally, coinsurance is the percentage you pay for a healthcare service after you've met your deductible. All those combined add up to your total cost for healthcare. One way you can reduce your out-of-pocket costs for healthcare is by participating in a flexible spending account. This account lets you set aside money before taxes to pay for certain medical expenses. You can learn more about flexible spending accounts, or FSAs, at the following link. On the PPO and EPO plans, you're really deciding how you want to absorb the additional cost for that increased flexibility and choice of provider. For the PPO, you pay for this access through higher deductibles, compared to the HMO plan, which has the same monthly premium cost but no deductibles. For example, if you have a hospital stay, the HMO plan will pay the entire cost of your stay after you pay a $200 copay. But you must use a UK healthcare hospital. On the PPO plan, you'll pay your $500 deductible first, then 20% of the remaining cost, up to a $3,000 maximum. But you'll have more choice in which hospital you visit. The PPO plan will pay more of the portion after your deductible if you visit a UK healthcare hospital. With the EPO plan, you pay a higher premium each month and have higher co-payments than the HMO, but there is no co-insurance to pay or deductible to meet. So for a hospital stay, you have a choice of which hospital to visit. If your stay is at a UK healthcare hospital, you will pay a $300 copay with no other costs. If you visit another hospital in the Anthem network, you will pay a $500 copay with no other costs. I hope this video helps you with making your decision during open enrollment. If you have any questions, please let us know at benefits@uky.edu.